So once you've administered the naloxone and observed for a count of 10, if you notice that the victim is not responding, then the next step is to go and provide CPR. Now, modern CPR does not stress the importance of giving rescue breaths. However, in the context of opioid overdose, the victim fundamentally is going to die from a lack of oxygen, which will lead to cardiac arrest. Okay? So we feel that it is very important for the rescuer to strongly consider being willing to give rescue breaths to the victim because they need air and you're going to provide them with that air. Okay? And it's understandable that in the context of a worldwide pandemic that people might be hesitant to do so. Therefore, all of Marchese's naloxone kits contain a CPR face shield with a one-way valve. This means that when the rescuer gives a breath through the mouthpiece, through the valve, nothing comes back up to the rescuer from the victim. Okay, so this is a very, very important safety feature for the rescuer. Now, in order to use a face shield, the first thing you want to do is, of course, approach the victim. You want to open up their mouth because you want to see if they have any contents in their mouth, any food or vomit or gum or anything like that. And if you do notice anything, you can just grab their tongue, move it out of the way, and just swish out the contents of their mouth with your finger. Of course, you have gloves on to protect your hands as well. Okay? And then the next thing that you want to do is open up your face shield. Find that mouthpiece. The mouthpiece is for the victim. It's not for the rescuer. So what you'll do is you'll insert that into the victim's mouth very carefully. You'll drape it over their face, okay? And you should be able to see that the writing, you should be able to read the writing on the face shield. You know you've got it the right way, okay? Then what you're going to do is you're going to raise up the victim's chin, okay? This will straighten out their airway, and then you're going to pinch their nostrils, and then you're going to give a breath through that valve. There will be some resistance because of the presence of the one-way valve, okay? But that is normal. You should look for the chest to just begin to rise. Out of the corner of your eye, you'll see that. Then you can let off, and then let the chest fall, okay? And then give another breath through there, and then watch their chest rise and fall. You give 2 breaths like that, and then you switch to chest compressions, okay? In order to give chest compressions, you might have to manipulate the victim a little bit, okay? You might have to move their arm in order to be able to get into the position. What you want to do is take a hand, nestle it up under the armpit like this, and then pull it straight across the chest. And the butt of your hand should now be located on the lower part of the sternum where you're going to apply the compressions, all right? Then next thing you want to do is interlock your fingers, lock your elbows, and then you're going to give 30 compressions at the following rate. 1, 2, 3, 4. Staying alive, staying alive. If you follow that rhythm, that's the right speed. And you want to count to 30 that way. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 18, 19, 20, 2, 3, 5, 6, 7, 30. Now we're evaluating the victim. If not, they're not recovering, we're going to give them 2 more breaths, okay? So following the same procedure as we did earlier. We're going to follow that cycle of 2 breaths, 30 compressions, 2 breaths, 30 compressions for a set of 4. And we're going to evaluate all the while to see if the victim is recovering. Those compressions are helping to circulate that naloxone so that it can get into the bloodstream and get into the victim's central nervous system to help them recover from the overdose.